Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia, and this is VEC Vaccine Notes. Today we're going to talk about Ebola virus. We'll talk about the disease that's caused by this virus, the vaccine we have to protect against it, some common questions we receive here at the Vaccine Education Center, and we'll finish up with a discussion of the relative risks and benefits. Cases of Ebola don't usually occur in the United States. But when Ebola is in the news, it often sets off alarm. That's for three reasons. One, people who are infected often have severe bleeding called hemorrhagic bleeding. Two, the disease is contagious in a lot of different ways that make people concerned. And three, its effects on babies when their mothers are infected during pregnancy. Now, cases of Ebola don't usually occur in the United States. They more often occur in Africa. But sometimes if people are traveling and infected while in Africa, they're brought back to the United States for treatment. Because of the low risk for getting Ebola, most people in the United States aren't recommended to get vaccinated. But there are two groups who can benefit from vaccination. The first is healthcare workers or others who are transporting people who are infected with the virus. And the second group are people who work in labs where they are working with the virus. Now, it's important to know that even with vaccinated laboratory workers, Ebola virus is a type of virus that can only be worked on in certain types of safety laboratories so that there isn't a chance for it to escape the lab. So let's get started by talking about the disease caused by Ebola virus. People come in contact with the virus when they interact with wild animals infected with the virus. But once infected, a person can spread the virus to other people. This happens through contact with their bodily fluids. Now, there's three important points here. First, it's contact with any bodily fluids, even those you might not normally think about, such as vomit or amniotic fluid or breast milk or semen. Second, even after a person dies who was infected with Ebola, their body fluids can still cause infections in people who handle those fluids or come in contact with those fluids. And third, people can also be infected if they come in contact with fluids that are on other objects, such as bedding, clothing, or needles. One other note is that even after men have recovered, they've been known to be able to spread the virus through their semen after recovery. First symptoms are usually mild, like fever and fatigue. Then people will usually go on to have gastrointestinal symptoms like abdominal pain, nausea or vomiting, or diarrhea. They may also develop a rash. Because the virus damages blood vessels and causes issues with the clotting of blood, people will start to have unusual bleeding, such as significant bruising, or bleeding from openings such as the eyes, nose, gums, or vagina, or even from places where they've had injections or if their skin is broken. They may also have blood in their vomit or feces, and eventually they may go on to develop issues related to their heart, or they can have confusion or aggression. Typically, about half of people who develop symptoms will die from their infection, but these rates do vary based on the outbreak. So when you think about an infection where 3 to 9 of every 10 people who are infected could potentially die, you see why this disease is so scary. Now let's talk about the vaccine that we have for Ebola virus. The first vaccine was licensed in the United States in 2019, and it's made by taking the gene for the surface protein of Ebola virus, which is the part that offers us protection, and placing it into another virus called vesicular stomatitis virus, or VSV. Now, VSV is known as a carrier virus. It can infect people and it can replicate in people, but it doesn't cause illness. So by putting the gene for the Ebola virus surface protein in the VSV virus and then giving that as the vaccine, when the VSV virus replicates in people, it will also produce this protein, and our immune system will make a response against that surface protein to allow us to be protected. The Ebola vaccine causes mild side effects, such as pain or soreness at the injection site. Some people will develop some other side effects, such as fever or headache, joint pain, nausea, tiredness. Some people will get a rash, and a small number of people will have excessive sweating. But generally speaking, not everybody gets these side effects, and they only last a few days or up to a week at the most. Since Ebola is uncommon, the Vaccine Education Center doesn't get as many questions about this virus or its vaccine. However, we do get a few questions. One is whether there are multiple types of Ebola virus. And the answer to that is yes, there are 4 types. Most of the time when people are talking about Ebola virus, they're referring to Zaire Ebola virus. That's the most common and the most deadly type. The second most common and second most deadly type is called Sudan Ebola virus. The third type, called Bundibugyo virus, has only caused 2 outbreaks, and the fourth type has only been known to cause 1 case ever. It's called Thai forest Ebola virus, and that case occurred in 1994. Once people hear that there are more than 1 type of Ebola virus, the next most logical question is, does the vaccine protect against all types of Ebola virus? And the answer to that is no. The vaccine that's licensed for use in the United States protects against the most common and most deadly type of Ebola virus known as Zaire. And so in other countries, there are some other vaccines that are available for use, and there are other vaccines that are currently in development and being studied. But for now, in the United States, we only have the ability to protect against that 1 most common and most deadly type. So let's finish up with a quick look at the relative risks and benefits for this disease and vaccine. Today we talked about the severity of Ebola virus that has a death rate around 50%, but can be range from 30 to 90%. We talked about the fact that people with Ebola infection can have severe bleeding. They can have neurologic symptoms such as aggression and confusion. They can develop heart issues and they can go into shock. We also talked about the fact that the vaccine side effects are mild, but that for most people in the United States, there is no risk for Ebola. And so the vaccine isn't recommended for most people. The 2 groups, with exceptions, of course, are healthcare workers or people who are transporting patients that are infected with Ebola, or for laboratory workers working with the virus in a lab setting. When our team evaluated the relative risks and benefits, we determined that for most people in the United States, this vaccine doesn't make sense to receive. But if you are in one of those groups where you may be treating Ebola-infected patients, transporting them, or working with the virus in a laboratory, that the relative risks of the vaccine outweigh the concerns related to this disease. We hope once you've reviewed this information, you'll feel that way too. Thanks for listening today.